as you've expressed this issue in your lateral elbow of the pain with your golf swing, I wanted to kind of show you something that we're going to use called active release techniques. And so I'm going to use this to kind of help point that out. So all of the muscles that kind of extend the fingers and the wrist, they all originate up here on this outer side. And so if we visualize those as this real nice and stretchy band, um, through the years, as we age, of course you're not old, but as we age, there becomes small stressors along the way here. So if you want to visualize this thing being tied in a knot somewhat, what we'll see is it's causing more stress at this point because of this knot. So as we look and we see these adhesions or these scarrings and these muscles here, what we're going to try to do is work to loosen those up and undo those knots so that there is smooth, youthful motion.
I'm talking about.
All right. So if you will go ahead and give me your left hand here. Okay. So what you're going to do is I'm going to find a spot in here where there's a knot or an adhesion. And what you're going to do is whenever I ask you to, you're going to just extend and flex that wrist down. You're going to perform that motion while I apply pressure. We're going to do about 10 to 15 of these, and we may move around in certain areas of those motions, or unless we just feel that adhesion break up, you may be able to feel it too. There's a decrease in that discomfort. Mm-hmm. Now, the feeling that you're going to feel is going to be somewhat similar to working on like a knot in your back or something like that. Has your husband ever done that?
Yeah.
Of course he has.
Sometimes I do that for him too.
Of course, right? So reciprocal. Yeah. So anyways, it's going to feel like some people describe it as a hurt good kind of thing. Mm-hmm. You shouldn't feel pain, but there may be a little bit of discomfort as we push through that adhesion and that knot right there. Okay?
Okay.
But if you feel any kind of discomfort or any kind of pain, you also may feel that there's a difficulty with that motion just because. Mm-hmm. Right, there is a little bit of a knot right there. All right. So let's go ahead and work through that motion. There we go. Feeling pain, or what are we feeling?
Difficult to raise my stuff.
Mm-hmm. Good stuff. On this last one, let's maybe even apply a little passive. So you can do this yourself, so that way you can kind of gauge as your wrist goes down. Mm-hmm. Apply a little bit of a stretch right there where you'll feel maybe push past that point of where you were able to flex. Feel a little bit more tension there. Yeah. Okay, we're going to give you a break on that. We're going to try to find another area to work through, but we'll do sets of these. This will probably take us about 10 minutes to do this session right here. Okay. And we'll work through all of these muscles. There's a lot of muscles going on here and a lot of knots that we got to work out. All right. So as I'm looking at your range of motion in your lower arm, I've observed that you are using a lot of your shoulder to rotate over. When we rotate over, we call this supination. So to supinate, you're rotating your shoulder a lot to try to compensate. So it comes to my attention that our radius, this bone in our arm, thumb side here, is having some issues with motion. So to help open up that motion, I'm going to do a little bit of mobilization, Maitland mobilization, to help with increasing that range of motion. So we're going to start down here at the distal end, or the end closest to your wrist, and then we're going to work all the way up to this end down here. I'm going to apply force to your wrist. You just passively sit there and enjoy the ride. If there is any pain, let me know, stop me. I'm going to do about 20 to 30 of these compressions in the set, per set. and we'll do 2 to 3 sets. But what I need you to focus on is just completely relaxing and breathing, and we'll work through this together. All right, questions for me?
No, good man.
All right. All right, so we're going to start right here. You're just going to apply a little bit of pressure. It may feel uncomfortable with that motion, but you shouldn't feel pain. Now, some people say that it feels almost like if you bumped your elbow or hit your funny bone or something like that, maybe messing with a nerve.
Mm-hmm.
Shouldn't be uncomfortable.
It's not.
Notice a little bit of motion there in that.
Yeah, I can.
Okay. Okay, we're going to flip over. So we're going to supinate there and try to rotate that elbow in there. You go. Good. Same thing here. Just going to try to push down on that joint. Range of my end range. See if I can do a little bit of glide. You good?
Mm-hmm.
Is it uncomfortable?
No, it's not.
Okay. Checking on my patient, making sure she's not showing any facial signs of pain. All right. And as we work into the elbow more, we get you to slide across this way. Maybe extend just a little bit. And we're going to find that radius here. And again, if I push right on the radial head, it may be a little uncomfortable, so you just let me know if I'm not too sensitive of a spot. I'm going to work my way down just a little bit lower than that. And I'm going to apply pressure this way with those fingers. Good. Good. So this elbow issue has been affecting your golf swing. And so we have some issues with some extension there. We're going to work on getting that pain-free extension. So what we're going to do is mobilization with movement. I'm going to apply force on your elbow while you go through a range of motion, and I'll help you get through that. You're going to find that extension as far as you can get. We'll work through some flexion there too. But the goal here is to get full extension. I know you're having that trouble with that pain on the extension mark. So we're going to focus on that. What you're going to feel maybe is a little bit of pressure at the joint. As I'm applying that pressure, it may be an awkward force, but it shouldn't be painful force. So if you feel pain at all, please let me know. We're going to go through 6 of these, and we're going to rest, and we're going to do another 2 to 3 sets, depending on what we need. We'll reassess when we get done.
Okay.
All right? Any questions?
No.
All right, you can lay back. Right there, okay. You're going to slide over that way just a little bit. Good stuff. All right, we're going to let your arm just kind of hang off the table here. But what I need you to do is keep your shoulders strong and keep your elbow strong. And we're going to work through this plane right here, but focusing on that extension there. Got me? So that last few degrees right there. But what I'm going to do is I'm going to apply force this way, and I'm going to stabilize right here, right? And if you at all feel pain. Are you ready? Work through that. Okay. Extend. Focus on that extension. Good job. Get in that plane right there. Good job. Good job. Nice. Now in between, we're going to do a different one. And I'm going to give you this ball. This one is going to help you with that grip issue that you were talking about, having that grip issue on this outside area. I'm going to flip that palm down. I'm going to put my, this is a weed eater strap, shortened strap here. So we're gonna do the same thing here. I'm gonna pull a little bit of a glide. You're gonna squeeze that ball and extend the wrist up to the sky. Good stuff. Relax. Do it again. You may see that there is a little bit more difficulty in the extending just because I am pushing pressure on those muscles, but I'm also applying. Shouldn't have any pain. 5 or 6. That's 6. All right. Let's go. All right, now we're taking the technique that we just did and we're going to turn it into a self-mobilization technique with the good old-fashioned bungee cord. This came right out of the back of my truck. We need a bungee cord and a towel and a stable surface like a doorknob to attach to. So we're going to take this bungee, attach it to the door, there. We're going to take this towel and squeeze our side to pinch that elbow into my side. I'm going to keep my shoulders down and back, and I'm going to slide that arm in with the bungee cord close to my elbow, as close as possible. And then I'm going to apply tension and then move through that range of motion. Keeping that towel pinched to my side.